Ano, diretso. Check. Thank Check.
Sino mag ng ano? Meron bang ano to?
Absolutely. I was going to stay anyway. Let me dump this. I'll be right back. Nice person.
Hindi niya nakita yung paborito niyang si Jay. Hindi daw niya nakita. Ano gagawin natin? Uy, bakit ayaw ni...
You can see by looking at your watches, your clocks, it is 2 p.m. And we have a wonderful meeting planned for you in the sanctuary. Stuff that cake in your mouth and this direction. Thank you.
Good afternoon, everyone. Please find your seat. We're about to start. For our opening song, let's open our hymn, page 340, Jesus Saves.
Good afternoon. It's nice to welcome everyone, and those who are making merry in the narthex could be quiet, just slightly subdued. That would be lovely. Thank you. Glad that each of you are here, and we know that you're going to gain a blessing. I'm going to let David Nguyen introduce a very special guest speaker. Yeah. But let's begin with prayer, shall we? Father in heaven, you have given us life as a precious gift. And you are the one who sustains us, who provides for food, for air, for water, for every blessing, the sunlight. And you want us to be happy, not just for our own sakes, but that we might be a blessing for a longer time for those who need us and those whom we can bless. And also, you are honored and by the health of your people, even when we are ill or perhaps struck down. Our trust in you is a witness. So as we continue this series and as we seek to save lives, may it be by your grace that our eyes are enlightened, our hearts, and we willingly and happily, joyfully live lives that make us a blessing and prepare for a place in heaven above. Thank you in Jesus' name. Amen.
Would like to welcome everyone to our second presentation of the health series. And before I introduce our speaker today, I have an announcement. The key chain here, it's a Mazda. Please come up before you leave this place. Who has this? No? Okay. I just leave it here. Oh, that's Kyle. Okay. Honor and pleasure to introduce our sixth speaker tonight, Melody Gayle. You can not miss her. Bright red. She got her Bachelor of Science in Nursing from the Institute of Technology, Mindanao State University, and one of the top schools in South Philippines. She was a medical surgical nurse in Adventist Medical Center in Iligan City, oncology nurse at Asian and Medical Center in Alabang, Muntinlupa City, North Philippines. And she was health ministry leader at her church in the Philippines, and now she's also health leader here at our church. We are so proud of her. It's a blessing. And she's also a basic support instructor. And today she will give us a very practical and interesting presentation. Melody, now is the time.
They can use that. Thank you so much, David, and thank you so much everyone for coming for attending our program. So said, we're going to talk about basic life support. So make sure for everyone, certificate after this, it's American Heart Association. Make sure to register in front. We have our ladies in the table to put your names and get your number, because we're going to have a quiz and before the return demonstration. So why is it important for us about the basic life support? Or what is basic life support? Who knows? I know some of us here are medical employees. And may I know who had certificate already with BLS and CPR? Yeah, we have a couple of them. So basic life support is actually the same with CPR, so cardiopulmonary resuscitation. So why we should learn about this? As you have previous lecture, what is the top one cause of death in the U.S.? Is heart disease, and what it manifested with cardiac arrest. So I have a sibling, brother died because of cardiac arrest, and they live in the province. So we have a very little hospital there, and that day it was closed because they only have it's a private little hospital. And so the neighbors who helped my brother, they have to him to the next, which is, a long time. So if anyone could have do the CPR, it could have saved the life. But it is what it is. So I thought maybe we should learn. It is important to learn this. Even our kids, there is no age limit to learn the basics. You're a kid and you can do this one, you could save life. So, of cardiac arrest, what to do? We have this, what we called chain of survival for the adult and child. It's basically kind of similar. It's for the adult, they are more the cause of cardiac arrest is really from the heart. The kids, usually they are basically from respiratory. Kids doesn't have like their lifestyle. It's basically from respiratory. And even very seldom to see kids with cardiac arrest unless you're feeding them with like very salty, fatty foods, right? So first in the chain, let's focus in the outside of the hospital. So it's kind of similar with the hospital, but outside hospital, what should you do in the event if you see an unconscious victim or a patient or a victim with cardiac arrest? Yes, you activate the emergency service, and that is calling 911. But you have to go really early. It's called early recognition. So if you know that, this victim has a cardiac arrest, so before you call 911, you have to go check the patient first, right? Unless you call 911, 911 arrives and the patient is alive. So you have to make sure that it's really the victim really needs help. So, but before you go and check, you make sure is safety, right? You have to make sure you are safe first before you rescue the patient. You don't need another victim. So after you go and check the scene is safety, you check the patient pulse, breathing. So what do? You tap the patient, hey, are you okay? But you check of the patient and the pulse, you go this angle. So while checking, I'll show you the pulse pulse sites later where to check for the adult child and the infant. So while you check here, this is our pulse. You're listening if he is breathing, and as well as you're looking if there's a chest rise. All right? So that's how you check. And if there's no pulse, that's the time you should call the 911. And then after you're calling 911, if you have bystanders, you can ask them to help immediately. High quality CPR. That's what the hands are for, the represents. High quality CPR for, after that, if you can obtain AED, which is, we have it here, if it's available, it doesn't matter. The important is you do the high quality CPR, and then until the emergency of the 911, call 911, the 911 personnel arrives. So, but if you have the AED, it is very helpful if you get it as soon as possible. But do not jeopardize the CPR just to get the AED. It is very important to do the CPR first. After that, if you have AED, as what I've said, you do attach it to the patient. I'll show you later. And then once the patient arrives, you take it over to them, okay? And then they're going to be the one to bring it to the hospital for recovery, and then the patient, hopefully the patient survives, right? So for the next one is for the child. It's kind of similar. It's just for the child, you have to do prevention first, prevention for the child, and then the same matter, the same steps, okay? So where to check pulse? So we have a lot of pulse. Temporal, carotid, apical, we have brachial, and femoral, public, pallidus, and posterior tibial. Also, but the most common for the adult, you check in the carotid pulse, here, left, or right. Can you feel it? It's beating. Yeah, it's the one of the vein in the body, and then pulses. So that's for the adult, and the child, you use two. For the child, if you're having trouble here in the carotid pulse, femoral pulse. It's in your groin. It's kind of challenging to locate that, but it's good for the kids. And for the infants, you use brachial pulse. We wanted to, as much as possible, nearest to the heart. And for the why brachial pulse for the babies, the infants, it's because have you noticed the infants, they don't have much neck, so that's why there's easy access. So let's move on. So you check the patient. If the patient has pulse, you just need to provide wrist breathing, and make sure that you position the patient, and you suspect, like if the patient was, you have to make sure you position the neck. It should be aligned with the backbone, and you don't extend the neck, because we want to prevent the aggravation of if there's any patient, okay? But if you know that it's cardiac arrest, you have to open airway, you have to extend this one, their neck, make sure you straighten the airway, and then you provide rescue breathing. Some of the people, they carry this pocket mask, so they don't, contact your, how do you call this, your mouth to the person, to the victim. They have this alcohol gloves. Yeah, and this valve, you can connect, it's disposable. So you can connect it, it's like a filter, so you don't go directly there, right? And then you place this one. So extend that one, but if the patient is affected for injury in the neck or back, you do the jaw maneuver. So how do you do that? This mannequin, so there are some mannequins that there is jawline here, that you just push the jaw there, but you don't extend. You don't hyperextend the neck. You don't want further injuries. So that's how you provide the rescue breathing. But if there's no pulse, that's the time you provide CPR. Perform CPR. Okay. But how to perform CPR? Not just CPR. Today they emphasize high quality CPR. This high quality CPR, our target compression is 120 in a minute. So what's our normal rate? It's 60 to 100, right? For the adults. For the kids, it's more than that, 120 to 140. So our target is to 120 compression in a minute with a depth of 2 inches or 5 centimeters. For the child, it's 1.5 inches or 4 centimeters. Why? It's a common sense, because it's a child. We don't want to break the bone, right? Switching, we want to minimize interruptions. So if we could lessen switching, that would be good. But if you're tired and need switching, you can switch every 2 minutes. Why? And every 2 minutes, you can check the pulse also. After you do this, in 2 minutes, check the pulse if the patient has return of spontaneous sedation. But if not, you could switching until the emergency personnel arrives and 911 arrives. And then you make sure when you check the pulse, it should be less than 10. And then, how do you do how do you know if it's a full recoil? Why do we need a full recoil when you do chest compressions like this? Let me do this one here. See, if you're doing so fast like that, do you think you're helping the patient, the blood circulation to go? Because if you don't allow recoil, imagine you're using the hose, you're watering your garden, you press, and it's like you're so the blood cannot access. So we want to, when you press like this, allow a full recoil, okay? Like that. So you can have the blood, you can allow the blood to flow, especially to the brain. Okay, that's the high quality CPR. So again, forgot to use this one. Let's recall for the high quality CPR. Wait, hold on. What is the compression rate? The target is? Very good. And what is the depth for the adult? 2 inches or 5 centimeters. How about the infant? For the child, it's the same for the adult. Adult, it's 2 inches. For the infant, it's 1.5. The full recoil, yes or no? Yes. Why? Blood circulation to flow, especially the heart, because our heart needs blood also. And what else? We should minimize interruptions. Yeah. And what time do you check the pulse or switch? 2 minutes. Yes. Okay. Good. And then let's proceed to hand positioning techniques. So for the infant, they use the circling, hand encircling technique for 2 rescuers only. But now you can use it in 1 rescuer. So how do you do that? You go this way. So your easy access when you do your mouth, your rescue breathing. Or you can do the 2 fingers technique. Or sometimes I do the middle and this one. because more comfortable, you go this way. Or this way. And make sure always hyperextend, doing a rescue breathing, because we don't want, you're giving your rescue breathing, but it doesn't go to the lungs because you're flexing it, you're flexing the airway. So hyperextend or jaw thrust if suspected injury to the neck. For the adult technique, how many hands? 2. How about the child? 2. Actually, it depends, right? When I'm the rescuer and the child is, and I should do 2, right? Because it's kind of like a common sense, especially when you're Filipina. Most of the age, you're small and you're rescuing, and then you're doing one-hand technique. That's what they said before. For the child, you do one-hand technique. But what if the child is bigger than you? So you do 2 hands. But we're gonna have someone to demonstrate that later. So for the adult, 2 hands. For the child, 2 or 1, depends on the size. And how about the 2-finger or hand encircling technique? Then about that, how about the rescue breathing? How many rescue breathing should we do? Every 30 compressions. So this is our cycle. 1 minute CPR. 1 cycle is 30 compressions. So our target compression rate in 1 minute was 100 to 120. So this 1 minute CPR. So we have like 4 cycles in 1 minute CPR. So it's like 120 compressions. And every 1 cycle, you do 2 rescue breathing. So I say, I do 1, you count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, until 30. And then you allow, or if you're alone, you can do the rescue breathing. If you have a partner, if you have bystanders, you can, and that who knows the CPR or rescue breathing, you can ask them to help you so that you'll not be so exhausted. And rescue breathing, resume CPR, cycle 30, chest compressions. Just go back and forth, 30 to 30. But for the child, what is the compression rate and compression ventilation rate? Do you know? Same. If it's 1 rescuer, if infant or child, it's 30:2. If you're 2 rescuer, the adult is 30:2, the child is 30:2, the infant is 2. Why? We need more. That's what I've said earlier. The infant usually their diseases originates respiratory. They need more breathing, cardiopulmonary compressions. That's why we need more rescue breath. But if you're alone, 30:2. So again, for adult, how many? 30:2. For child, 30:2. For infant, 15:2. If that is for 1 rescuer, every one of them is 30:2. For 2 rescuer, only the different, 15:2. So you do that back and forth. The emergency arrives, but usually if you do it really good, and you are like at the event that you see the victim, and you do it properly, the patient could be alive even before 911 arrives. Gotcha? It might not last until 2 minutes, because I got my first CPR when I was in the hospital. I saw emergency card at the door patient, it means the patient is very near to death, that we put this thing there in case that the patient will have cardiac arrest. Luckily, I got the patient, and at 2 a.m. at 8 a.m. I was making everything, giving my medications, and then he was still okay, but the patient has this infection, and there are medication, so it got very severe. So 2 a.m. he was pulseless already. Oh my gosh, this is it. So I did my CPR. I told the relative, go to the nurse station, tell them blue. And then I was doing it. It was only like a minute, and the patient, came back to life. And it was like, oh, amazing. If you really do it and do it right, it might help the patient. But if not, just do it until when you do CPR, until when you stop it. I mean, how do you say that? When do you stop CPR? When help arrives, correct? What else? When do you stop? Okay, when the help arrives, or when the patient is already came back to life, right? Or return of spontaneous circulation. What else? You stop CPR if you're doing it long already, especially, for example, you're in a very, tourist from the civilization, and you and only the patient are there, and you don't have any help, and you're exhausted, so there's nothing to do, then just stop the CPR, right? Or if you're really willing to make the patient alive, you can do it as long as you get tired. You might get unconscious. So we want our safety also, right? So witness and witness. So what if the patient, there is a difference when to do CPR first, or you want to call first. So when you see the patient being unconscious, fall on the street, being unconscious, what do? Do you call for emergency first, or you do CPR immediately? No, for that, yes, that's correct. But for just two choices. For you, activate emergency service when you see the patient is unconscious and you checked it already, no pulse. Do you call the emergency service, or you do CPR immediately? When you see it, it's called witness unconsciousness. What do you do? Correct. You call first the 911. Why? Because how many minutes do you need? Our brain needs to have blood flow. It's 4 to 6 minutes, correct? So you know that you have few minutes to do the CPR. So you call 911 first. At least while you do the CPR, you have the help on the way. But when it is unwitnessed, you don't know how long the patient was laying there unconscious. It might be that you can ignore when you call 911. So when you don't see this patient collapse or being unconscious, no pulse, do 2 minutes CPR first before you call 911, okay? And then you can resume your CPR. At least you're giving your victim a blood flow, you're feeding it. You waste your time to call. It's not wasting your time. Anyway, so yeah, that's an important thing. So when you check your pulse after 2 minutes, make sure you're timing also that in that time after 2 minutes CPR, you do it all at once. If you want switch that time, and then you do the AED. So how do we do the AED? We have different kinds of but we have universal steps to how to operate. Actually, we have this in every working places, right? It is required because in the event of their staffs has cardiac arrest, they can do this one. So is it important to use this? It can, if the patient has I don't want to say the term, the nursing term, but cardiac arrest, there is a dysrhythmia in the heart, so it's not the normal rhythm of the heart. This can help to bring back the normal rhythm of the heart, okay? So that's why it is important also to get this one immediately when you're doing CPR, but do not get this one and jeopardize your alone just to get this one, okay? If you have a third rescuer, you can ask him to get it, but if you're two rescuer, you prioritize switching the airway and the CPR, okay? Universal steps, we have power button, power up, so turn on.
Adult patient.
Is adult and for child. So you can switch it. There is a setting here, adult or child, okay? But let's turn it off. So the universal steps, power, attach the pads to the patient. Some it's already connected like this one, but some AEDs you have to connect this. So that's why we have this universal steps. On, attach the pads and click analyze. And then after analyze, the machine will tell if the patient needs a shock. If not, to click the shock. If the patient the AED analyze and needs a shock, it will tell you. Just follow the prompt. It's very used. It will say, give shock to the patient. Make sure you give shock to the patient, it is clear. Nobody's touching the patient. Otherwise, you get shocked too. You're going to have. Okay, so when the AED tells you, give shock, press the shock button here. Okay? So 4 steps, power on, attach the pads, and shock if needed. All right? So we have consequences with this. I'm actually going faster than my in my slides, but this pads is for adult. Place that you can actually see there is a drawing or a sticker here. It says where you place the pads. So it's actually in this side and this side of the chest. So what if the patient is drowning? What do you do? Do you apply it on a wet chest? Oh, you gotta wipe it first, okay? Wipe it first because it will alter the conduction of this AED. And for these pads, for the adult pads, you can use this to the child. But some AEDs, they have pads for the child, for the infants. But I only have one. But you can use this for adult. You place it here and here. But for the child, you can sandwich the infant. Sandwich the infant. Front side, this one, you can put it here. And then this one, the other one on the back. So it's sandwich. But you have only a pad for the infants, you can use it for adult. The pads for adult, you can use it for the infant, but the pads for infant, because it's not enough, right? So how about if the patient has implants, pacemaker? Where do you put the pad? You do not put the pads on top of the implants. Put somewhere nearby, not on top of the implants, okay? And if the patient's chest is hairy, what do you do? That's if you have shaved. Like, they're all around? No, right? So if you have an extra pads, you can use the first pads, and you're like doing wax so that you can remove the hair. But if you don't have, just press it anyway and see if it works. If not, then just keep CPR. If it's not working, then don't take, right? Remember, less than 10 seconds. And what else? So yeah, if your patient is drowning, make sure you wipe it first. Wipe the area, dry it before you attach the pads. So for the child, what is the size? What is for the child? The pads for the child? You can use it for the adult? Yes or no? How about the adult? Yeah. Can you tell me what are the universal steps? It's power on, attach, analyze, if needed. Very good. So that's all for our AD. And let's move to what else? So yeah. Oh, another transdermal medication. Just like nitroglycerin patch, they put it here. You have to remove that before you place the pads, okay? If the victim transdermal medication here, it's like a plastic they place here. So that's it. So you wait for the EMS or the 911 to arrive. ROS is return of spontaneous circulation. If not, continue CPR until your help arrives. I've told you already, so when it's already 20 minutes, it's so tiring. Even like 5 minutes, 10 minutes, especially your victim is like big, it's so tiring to do CPR, I tell you. So when you're exhausted, then and it's like there's no, then stop. But if you can, then do it. So, oh, here, when AED available, you don't really have to stop, but make sure it's during the 2-minute, like a 2-minute CPR, you pads quickly, less than 10 seconds, right? And then after you give a shock, what do? Correct, continue high quality CPR immediately. After shock, CPR, and then rescue breathing, okay? What else? So before we go there, let's have, I already told this person, Miss Myra here, demonstrate like a team, switching the CPR and our rescue breathing. So we're gonna put it on the floor. Oh, where should I put it? Here? Yeah, just here, and everybody can see it. Nurse Myra. Let's do it here. Okay. See a patient. What do you do? Yeah. Before you go to the patient, make sure you're safety. Yeah, safe. So I'm gonna have you demonstrate it, okay? You can do it, okay? From the top. Oh, do you have a microphone or something? Yep. So this one, sorry, I forgot. This one, I want you to try this one because once it has a feedback device, if you're doing it right, it will turn to. If you're not like pumping deeper or deep enough, it will not light on. So if you're so fast, it will appear yellow, just like the traffic light. Slow down. Okay? Okay, after you see the patient, no pulse, you call for 911 and then you start switching. You can use this one. So we have this ambu bag or black valve mask. Do you have this one in your working place? This is for infants. if you don't have this, that's the time you can. If you don't have this, you can use your mouth. Especially for the infants, you don't have to be scared in giving rescue breath. Okay, go ahead. So you count. I want you to count 1, 2. Louder.
6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 1, 2, 3, 4, 5, 6, 7.
See, it's double green. Very good.
2 greens.
2 rescue breath, hyperextend, and then
1, 2,
resume.
4, 5, 6.
And then the third rescuer arrives, and I'm getting the AED. So doing CPR, I'm gonna put the pads here.
9, 30.
And then you quickly, while he was doing that, actually I was late already. CPR.
5, 6, 7,
And then later,
11, 12,
power on. Then quick analyze while he was still doing CPR. If it needs shock, give shock while he's already done with the 30, okay? And then resume CPR. Okay, because I don't want to shock them. Okay. You don't interrupt their CPR, all right? That's good enough for him. Thank you so much, guys. I'm gonna give you, Bob. You guys are pocket mask. So you see that you don't interrupt them, you don't stop them. These pads, okay? While they're doing the CPR, make your way to attach this one. Power button on, analyze, and if needs to be after the 30 compressions, give the shock. But give the shock, make sure clear the patient, okay? Because you might end up all victims now. So that's how easy it is. Very easy and very important to know. It's very vital. And wherever you go in the hospital, we need BLS. The different thing is that in the hospital, we call it advanced cardio. I don't even know the meaning. ACLS, advanced cardiac life support, because we put the tubes, we give medications, and we can attach the ventilators. That's what we have. We don't have it here, but we still do BLS, basic life support. So that's it. And we can do our anything. Oh, so when do we use CPR? So you do CPR, but you don't know when to use it, or where do you use it, in what event. So if you have them, but remember, don't forget it. Oh, I know CPR, I can rescue that one. Swim. Make sure you're safe, right? Yeah. So don't get so excited. Make sure you have the victim in the safe first, and make sure when you do CPR, it's in a plain surface, not in an even. You do CPR and like this, right? It's in a plain surface. So when the patient is drowned, you do CPR, and if the patient returns to spontaneous circulation, usually the drowned patients, they're like vomit the water that they have intake, right? You position it to after the victim recovers, you put it in the left side, sideways, so if the water can come out from the mouth. So what else? In what cases do you use CPR? Choking, right? You know choking? How do you choking? So I have my nephew. I was a working student. I worked with my sister before, and then until I graduate, I still visit them like once in a week. And my brother brought his nephew, the son of his sister, so to play with their son. I was in the kitchen. He did not know that the kid was eating something from the toy. It looks like cotton. That it goes bigger inside the mouth. So when I heard him coughing, so what's the sign for the infant for choking? Coughing. They cough, cough, cough until they blue. So I run there, and he was already blue, and my how do you call it? brother-in-law was like this, shocked. He doesn't know what to do. So I immediately, how do you position the infant, or even the like 1 to 2 to 3 years old, is small enough that you can carry? You hold here, do 5 slaps. And support with your knees. 1, and then in the front 2, 5 chest thrust. 1, 2, 3, 5, back and forth. And then before you do that, they said, check the mouth if you can take the far object that is in there. But if you cannot see it, don't pursue that, because you might put it worse, right? So if you can't see it, do 5 back slaps and chest thrust, 5 forth, and then after like each of that, check if there's anything in the mouth that you can remove. Okay? But it took only like 5 slaps, and then he coughed it out. So that's for the infant. But what if, let's move first. How about for the child? You do this one, Hamlet or whatever, Hamlet, whatever. Okay, as long as, so it shows there for the child, you do make a fist, your thumb inside, here below the xiphoid process or your rib. There's your stomach there, and you push this one. You're basically making a pressure inside your stomach, is your valve upper here, the esophagus, so that the food cannot come up back easily. It has cardiac sphincter and caloric sphincter. So it's like this. The end of stomach sphincter, so it's like a valve that closes the stomach, that the food that you eat can go back easily, right? Back up. Cardiac sphincter, pyloric sphincter, if I'm right, you can search it, you can correct me if I'm wrong. So your stomach is here in this part, so you're basically doing it pressure here, so it could go back up, right? So make it 5, and do back slaps also for the same for the infant, child, and adult. So same with that one. So how about for the pregnant? What do you don't press here for the pregnant, right? You don't want to hit the baby or traumatize it. So you do chest thrust. But it doesn't sound effective, right? For doing chest thrust for the pregnant. But anyway, if you do choking interventions and it's not effective enough and the patient still collapses or becomes unconscious, what you do CPR. CPR is like the last resort, right? CPR still. And then, so, it's out of the topic, but as one, I believe they give you in the registration. This is an assessment for stroke that you use at your home. It's very important. If you wanted to learn more about stroke, cardiovascular diseases, we have on September, we have a doctor who's coming, our guest speaker, who's going to explain. But this is for nurses, and you can do it too for a quick assessment. Be fast. So when you TIA, transient ischemic attack, or stroke, you have to be quick, be fast. Time is very important. I'll tell you why later. So B for the balance. Get out of the balance. It has some description there that is very self-explanatory. person has a sudden loss of balance because, of course, you get paralyzed in the other half, right? And you check the eyes. If you cannot see on the other side, it's probable stroke. And the face is drooping on the other side, and you ask them to smile, it's uneven. Even when they speak, it's slurred speech. That's why it's speech there. And your arms, have them raise their arms. They cannot raise the other one. And then the time, make sure that you take note of the time when it started. Because when you call 911, they're going to be on to pick up the patient. Make sure you take note of the time so you can tell them. So once they arrive, they can call immediately to the receiving hospital, the nearest hospital, because they have a medicine, PA, to reverse the paralysis. But it's very vital. Within 4 hours, it's 98% that the patient can restore their paralysis. So be fast. So I had a patient during the COVID times. He was already like 70s oxygen, and the doctor wanted to intubate him, but he died too. But for the longest time that he was struggling and stroke, so we asked him, hey, you cover one eye? How many fingers is this? If he cannot see it, then probable stroke. We asked him how many he cannot see, but the other eyes he can see. And then the way he was blurred and the face was drooping, and raise your arms, he cannot raise the arms. So we immediately called, in the hospital it's different, of course, hospital, goes and we see rapid response team so that the CT scan, if they have patient, they can clear it out, so prioritize the patient with TIA. So for us at home, if you're like, hopefully not your relative, your family, you can use that one also, and you make note of the time, so when the health, they can tell the hospital, how it works. And we're gonna have our quiz for those who want to get certified or renew your license. We can have our quiz. We can have our latest papers, and it's only 25 questions, very basic, and we have discussed it already. So there's no way you cannot answer it. So, Imani, Miss Dana, if we could distribute the papers, answer sheets. We have separate answer sheets, and the questionnaires, please write in the questionnaire. Put your answers on the test papers, okay? It's very basic, and thank you for listening. And that we're gonna have, do we have visitors here? We can prior them to do the return demonstration. If they wanted to try, you can try it first. I can always bring this every Saturday and have you do the return demonstration. Okay? But after the quiz, it's only question. Thank you so much. Oh, anyway, do you have any questions? I'm sorry. Questions? No, it's very easy and important. Yeah, we're gonna keep the record for your quiz for your certificates. Do you want one of this, Norm? I can give you one. Huh? Sure. Oh, you can buy this one, Amazon. Very, very cheap. Thank you guys for attending, and yeah.